Despite taking medicine and maintaining a healthy diet, are your blood sugar levels still rising? It's possible that you're missing an important component. Startling truth. Insulin sensitivity, neuron regeneration, and blood sugar regulation are all directly impacted by vitamin deficiencies, which afflict more than 80% of diabetics. The top 7 vitamins that every diabetic needs to take are revealed in this video. If you want to prevent problems like nerve damage, heart strain, kidney stress, and frequent energy crashes, this is a must, not an option. Up to 1.5% improvement in HbA1c can be seen with some of these vitamins. Reduce fasting glucose by 25 mg per deciliter and even help the nerves work again. Stay with me if you're sick of doing everything correctly and still not feeling your best. Your daily health game may change as a result. Let's begin with the first. First, vitamin D. Because it affects several bodily systems, vitamin D is essential for controlling diabetes and its consequences. According to studies, having enough vitamin D might increase insulin sensitivity by as much as 20% to 25%, greatly reducing insulin resistance by assisting the body in responding more effectively to insulin. For long-term blood sugar control and to lower the risk of complications from diabetes, this enhanced insulin function can lower HbA1c levels by roughly 0.8 to 1.2%. Beyond blood sugar, vitamin D promotes healthy vascular endothelial function and reduces inflammation, which lowers the risk of heart disease in diabetics by roughly 12 to 18%. By promoting nerve regeneration and reducing diabetic neuropathy symptoms including pain, tingling, and numbness, this vitamin also protects nerve health. Vitamin D helps the kidneys, which are frequently at risk in diabetes, by controlling the balance of calcium and phosphorus, which lowers the risk of diabetic neuropathy and kidney damage. Additionally, it helps decrease postprandial glucose rises by around 8 to 10% and lower fasting blood glucose levels by about 10%. Reducing blood sugar swings, which frequently exacerbate the consequences of diabetes. Maintaining vascular flexibility and reducing arterial stiffness, both of which are elevated in diabetes, helps avoid high blood pressure and stroke risk. Vitamin D is essential for these processes. For most adults, the usual recommended dosage is between 1,000 and 2,000 IU per day, which is both safe and effective. However, in order to prevent kidney stones and hypercalcemia, doses over 4,000 IU should be avoided unless under a doctor's supervision. Fatty fish, such as salmon, mackerel, and sardines, provide 400 to 600 IU of vitamin D per 3 servings. Fortified dairy products provide approximately 100 EU per cup, and egg yolks provide approximately 40 IU each. Cholecalciferol, or vitamin D3, is the recommended supplement because of its greater absorption and effectiveness. Often offered in 1,000 to 2,000 IU capsules, liquid drops for adjustable dosage, and mixed formulations with calcium to promote cardiovascular health and bone strength. For diabetics looking to maximize their general health, ensuring adequate vitamin D is essential because it boosts energy metabolism, supports the immune system, and aids in maintaining healthy insulin signaling. Vitamin K is number 2. Although vitamin K may not receive as much attention as vitamins D or C, it is silently performing some of the most laborious tasks behind the scenes for diabetics, and the benefits are difficult to overlook. You should be aware that vitamin K2 can increase insulin sensitivity by up to 17% if you suffer from insulin resistance, facilitating simpler glucose regulation and improving your body's response to insulin. And it's not just about being sensitive. It may reduce HbA1c by 0.5 to 0.8%, according to research. A significant decline that results in fewer long-term issues. Even more remarkable is the fact that it stabilizes fasting blood sugar and supports smoother glucose levels after meals by reducing post-meal glucose rises by over 15 to 20%. Osteocalin is a hormone that improves the action of insulin, and it keeps swings under control. This is something that every diabetic wishes to see on their morning meter. However, sugar control is only one aspect of it. Vitamin K2 protects your heart from hardened vessels and enhances vascular health by preventing calcium from accumulating in the arteries. Better circulation, lowered blood pressure, and a decreased risk of cardiovascular disease, a major issue in diabetes, are the results of this. By reducing oxidative damage and delaying the course of the disease, it also promotes kidney health, which is crucial if you run the risk of developing diabetic neuropathy. Additionally, vitamin K helps maintain the integrity of the myelin sheath and the synthesis of sphingolipids, which are protective fats that help prevent diabetic neuropathy, numbness, and burning sensations in the hands and feet. It even promotes a healthy immune response, bone strength, and blood coagulation, all of which are compromised by diabetes. About 90 micrograms for women and 120 micrograms for men should be consumed each day. But the MK7 version, which your body absorbs more effectively, has therapeutic amounts supported by research that can go up to 200 micrograms per day. Just be careful not to take too much if you're using blood thinners like warfarin, as excessive dosages can affect clotting drugs. Natural sources include collard greens, about 770 micrograms per cooked cup, Brussels sprouts, around 300 micrograms per cup, and natto, a fermented soybean powerhouse with over 1,000 micrograms per tablespoon. Life Extension Super K, if you're selecting supplements, contains 260 micrograms of both K1 and K2. Now, 100 micrograms of pure MK7 are delivered, together with 100 micrograms of Doctor's Best Vitamin K2. Ideal for ongoing assistance. Vitamin K is the unsung hero of your diabetic toolbox because of its many functions in glucose regulation, artery health, nerve healing, and organ protection. And it's about time it received the recognition it merits. Third, vitamin B12. Every diabetic should be aware of vitamin B12's silent power, especially if they are on metformin, a common medicine that lowers B12 absorption by over 30 to 40%. Up to 22% of diabetics experience deficiency, which leaves their nerves and energy levels subtly sapped. This can lead to numbness, burning feet, instability, brain fog, and even memory problems that resemble dementia. But nerves aren't the only factor. B12 is essential for enhancing insulin sensitivity. Research indicates that raising B12 levels can lower HOMA-IR scores by as much as 20%, improving insulin sensitivity and reducing insulin resistance without the need for additional medication. Additionally, it promotes glucose metabolism, which improves how well your cells absorb sugar. Particularly crucial after meals. This results in more consistent fasting glucose levels and less post-meal sugar increases. Although B12 does not directly lower your HbA1c, it does indirectly lower those long-term sugar levels by enhancing nerve transmission and mitochondrial health. Moreover, it lowers homocysteine levels by about 25%. It lowers the chance of strokes and silent vascular damage, which diabetes frequently conceals, and protects your heart, kidneys, and blood vessels. Healthy B12 levels in diabetics are associated with improved circulation, increased energy and happiness, and even improved mental clarity. Although the daily requirement is only 2.4 micrograms, many diabetics need 250 to 500 micrograms, particularly in the more readily absorbed form of methylcobalamin. Increase your intake only if your doctor advises it, as prolonged use of more than 1,000 micrograms can cause anxiety, acne, or methylation pathway disruption. Beef liver is one of the best food sources, containing 70 to 80 mcg per 100 grams, 5 micrograms of nutritional yeast per spoonful and a staggering 98.9 micrograms of clams. Excellent for plant-based diets. Methylcobalamin, 500 micrograms, solar sublingual, nuggets, 1000 micrograms, pure encapsulations, and Nature's Bounty are supplements. All of the quick dissolve B12 options are great, particularly for people who have digestive problems. Any diabetic who wishes to remain alert, mobile, and independent without allowing issues to silently creep up on them must take this one vitamin, which helps your nerves, brain, heart, blood, and even glucose control. Vitamin B1 is number 4. Thiamine, another name for vitamin B1, is one of the most underappreciated vitamins that, if insufficient, can subtly exacerbate diabetic complications. This is concerning because research indicates that low B1 levels are seen in up to 76% of diabetics. The metabolism of glucose depends on this vitamin. Additionally, when it is low, your body finds it difficult to turn sugar into energy that can be used, which exacerbates insulin resistance and fasting blood glucose levels. By regulating the enzyme activity within cells, thiamine supplements have been proven to increase insulin sensitivity by 24% and lessen post-meal glucose rises. Additionally, it helps shield the beta cells of the pancreas, which are essential for the synthesis of insulin. According to one study, taking thiamine supplements improved nerve conduction velocity, decreased diabetic neuropathy symptoms like tingling, numbness, and pain, and lowered HbA1c levels by 17% over 3 months. Additionally, thiamine serves as a potent renal defender. It aids in the roughly 40% reduction of albumin levels, a crucial early indicator of diabetic kidney injury. On the vascular side, thiamine promotes endothelial function and relaxes blood vessels, which enhances circulation and lowers blood pressure, ultimately lowering the risk of heart failure, stroke, and diabetes. Although 1.1 to 1.2 milligrams should be consumed daily, diabetics may require up to 300 milligrams in separate doses, particularly if they exhibit symptoms of nerve damage. Since thiamine is water-soluble and excreted in excess, taking too much of it is usually safe. However, in rare instances, extremely high doses may cause mild restlessness or skin irritation. With natural sources like pork, about 0.9 milligrams per 100 grams, sunflower seeds, 1.5 milligrams per 100 grams, and green peas, 0.3 milligrams per half cup, you can increase your intake through meals in a moderate yet efficient manner. Because it absorbs more readily than ordinary B1, benfotiamine 150 mg twice a day is particularly beneficial for protecting diabetic nerves. Additionally, take into account the life extension bioactive full B complex in the 300 mg prescription drug benotamine, which is clinically utilized for vascular health and neuropathy. Vitamin B1 does more than only help your kidneys and nerves. It benefits the entire cardioembolic system, including the brain, energy levels, blood vessel elasticity, and the stabilization of blood sugar fluctuations before they do silent harm to the body. Fifth, vitamin B9. Folate, also referred to as vitamin B9, is a silent powerhouse that helps shield the body from long-term diabetic damage. However, most people are unaware that low folate levels, which can exacerbate insulin resistance, raise fasting glucose, and covertly cause vascular inflammation, are present in over 40% of diabetics. Folate is necessary for healthy neuronal signaling, homocysteine metabolism, and DNA repair. Additionally, when it is lacking, the body is more vulnerable to glucose toxicity and oxidative stress, which can cause clinical trials to show a 28% decrease in insulin sensitivity. Cardiovascular disease is directly associated with elevated homocysteine levels, which folate helps regulate. Studies have shown that taking a folate supplement can lower these levels by as much as 30%. Lowering the risk of heart attack and stroke while also greatly enhancing arterial flexibility and endothelial function. Low folate in diabetics promotes advanced glycation in products and interferes with cellular detox mechanisms, which leads to microvascular problems, particularly in the kidneys and retina. HbA1c levels can also be stabilized with folate. Additionally, research indicates that individuals with type 2 diabetes can lower their HbA1c by 7 to 10% by consuming 400 to 800 mcg each day. It may help alleviate burning and tingling feelings, which are early signs of peripheral neuropathy, and it gradually promotes neuron regeneration. A vitamin B12 deficiency may be concealed by excessive folate intake, particularly from synthetic folic acid tablets above 1,000 micrograms, which may cause nerve damage. Balance is therefore essential. Lentils provide 358 micrograms per cup cooked, asparagus provides about 134 micrograms per half cup, and spinach provides about 263 micrograms per cup cooked. Suitable for supplements, it is high in fiber and blood sugar friendly. 1 mg Thorn Research 5 mthf. Because they use methylated forms that are better absorbed and don't need to be converted by the liver, foods that contain 800 micrograms of folate and 400 micrograms of solar folate are now the best choices for diabetics. The protective effects of folate extend beyond blood sugar and nerves. Additionally, it lowers inflammation, enhances mood regulation, promotes brain health, and aids the liver in detoxifying dangerous byproducts of elevated blood sugar. Additionally, it improves insulin responsiveness and decreases fat buildup in muscle and liver tissue, which indirectly lowers post-meal glucose increases. Vitamin C is number 6. Vitamin C is not limited to treating colds. It's among the most underutilized diabetes management tools. Startled? This is the reason. This nutrient is simple but powerful. Vitamin C has been demonstrated to reduce post-meal glucose rises by 20% and fasting blood sugar by 25% when taken daily at 500 to 1,000 milligrams. But that's not all. The protective effects of folate extend beyond blood sugar and nerves. Additionally, it lowers inflammation, enhances mood regulation, promotes brain health, and aids the liver in detoxifying dangerous byproducts of elevated blood sugar. Additionally, it improves insulin responsiveness and decreases fat buildup in muscle and liver tissue, which indirectly lowers post-meal glucose increases. Vitamin C is number 6. Vitamin C is not limited to treating colds. It's among the most underutilized diabetes management tools. Startled? This is the reason. This nutrient is simple but powerful. Vitamin C has been demonstrated to reduce post-meal glucose rises by 20% and fasting blood sugar by 25% when taken daily at 500 to 1000 milligrams. But that's not all. Additionally, it can lower HbA1c levels by 0.5% to 1.2%. Nevertheless, if you're having trouble controlling those numbers, is a huge win. Why is it so successful? It reduces the harmful effects of oxidative stress, a major cause of nerve damage, kidney issues, heart disease, and even vision loss, while also subtly increasing insulin sensitivity, which helps your cells absorb glucose more efficiently. It reduces your risk of cardiovascular problems by up to 33% by supporting vascular health, strengthening blood vessel walls, and increasing nitric oxide. Additionally, it shields the kidney's sensitive filtering units, lowering urine albumin levels and other early indicators of renal impairment. It also helps the nervous system by reducing inflammation, which causes tingling, burning, and numbness. It increases the production of collagen, which preserves the skin and tiny blood vessels, particularly in the feet and eyes, and hastens the healing of wounds. However, too much isn't preferable. For those with iron overload, taking more than 2000 milligrams per day can result in kidney stones, diarrhea, or other problems. Therefore, it's important to stick to the daily safe range. Do you want to acquire it organically? Choose red bell peppers, which provide about 190 milligrams per cup, or guavas, which offer an impressive 228 milligrams per fruit. Additionally, keep in mind that each kiwi contains 71 milligrams. Additionally, these include fiber, which helps to maintain blood sugar homeostasis. If you're considering supplements, Live On Lab's Lipospheric Vitamin C 1000 milligrams, which is intended for improved absorption, Nature-made Vitamin C 500 milligrams, and Doctor's Best Vitamin C with Quali C 1000 milligrams are all reliable choices. Beyond blood sugar, vitamin C supports detox pathways, protects pancreatic beta cells from glucose damage, and protects your heart, eyes, kidneys, nerves, skin, and even liver. It's more than just a sidekick because of this. When you have diabetes, it serves as your body's first line of defense. Vitamin E is number 7. Your body uses vitamin E as a natural defense against the damage that high blood sugar causes without you realizing it. Particularly for your heart, blood vessels, kidneys, and nerves, which suffer the most from diabetes. There is more to this fat-soluble antioxidant than meets the eye. It actively combats free radicals, which accumulate more quickly in diabetics and hasten cellular aging. According to clinical studies, it can improve insulin sensitivity and lower insulin resistance by up to 22%, which will make it easier for your cells to use glucose rather than allowing it to build up in your blood. Better yet, regular use has been associated with a 0.5% to 0.8% reduction in HbA1c in just 12 weeks, which has a significant impact on long-term blood sugar regulation. This is what the majority of people overlook. By re-establishing endothelial function, vitamin E also maintains the smoothness, elasticity, and absence of early plaque accumulation in your blood vessels. For diabetics who already have cardiovascular issues, this easy-to-take vitamin can reduce the risk of heart attack and stroke by about 25%. Additionally, it reduces oxidative stress markers associated with the growth of diabetic neuropathy, protecting the kidneys while lowering nerve inflammation and easing tingling, numbness, and searing pain. By lessening retinal cell damage, it supports better vision in the eyes and slows diabetic retinopathy. Although 15 mg per day is the recommended amount, taking too much can have negative effects. If you're using anticoagulants like warfarin, crossing 1,000 mg daily could severely thin your blood and increase your risk of hemorrhagic stroke or internal bleeding. Check your dosage frequently. With 7.4 to 4 mg per ounce, sunflower seeds are a superfood. Almonds and avocados are next in line with 7.3 and 2.7 mg per ounce, respectively, and both fruits provide additional beneficial fats that help to stabilize blood sugar levels. Solar Natural Vitamin E 400 IU, currently known as Vitamin E 400 IU mixed tocopherols, and Nature-made Vitamin E 180 mg are reliable choices for diabetics if they must take supplements. With few fillers, all provide antioxidant support. In addition to providing protection, vitamin E aids liver detox, nourishes skin, increases immunity, and maintains artery flexibility when taken daily. Operating silently in the background while protecting the body against the effects of diabetes. Managing your diabetes requires giving your body the proper vitamins each and every day. These critical nutrients can have a significant impact on blood sugar regulation, energy production, and organ protection. Are you prepared to change? For more effective health advice, hit the like button, subscribe, and forward this video to anyone who is prepared to advance their diabetes treatment. Your path to improved health begins.